These videos are not intended to replace the expert advice of your health professionals. Please note, not all care challenges discussed occur for everyone with MND. The strategies provided are not extensive.
Comfort in bed seems to come up a lot because I think people get really uncomfortable in that reclined position, but also the bed becomes uncomfortable.
We never thought about bed comfort. We both just got into bed and went to sleep.
When we're well and our muscles are functioning well, we can wriggle and shuffle around and reposition, and we often do that without thinking. Someone with MND, on the other hand, might struggle with that a bit more, and that in turn can lead to issues with falling asleep and staying asleep.
Comfort in bed is a really subjective thing for everybody. Being able to address someone's comfort in bed can be quite a difficult thing to do.
In the early stages, carers might want to look at things like their bed setup and how many pillows someone is using and whether another pillow might help them to feel more comfortable.
Now he has like a body long, I call it the sleeping snake, but I think it's just called a pillow. This long black pillow. We work out where he wants the pillow and how he wants that positioned. Sometimes he doesn't want the full pillow, and then we've just got a couple of like flatter, normal pillows that we can just tuck underneath his legs or in between his legs.
Someone with MND might have experienced significant weight loss, which means that often lying on their bony prominences like your hips, your pelvis or your shoulder when you're lying on your side becomes very uncomfortable for them. So making changes to the mattress or using mattress toppers that provide cushioning and helping them with getting a good night's sleep is really important.
Someone may have had the same mattress for a long time and it may not be comfortable or appropriate. They might have like a dip in the mattress, which I guess isn't promoting comfort or positioning. So thinking of things about if it's a mattress that can be flipped or rotated, doing that and seeing if that makes a difference, or exploring a new mattress might be beneficial.
It might also be something as simple or as difficult as changing the setup of the room and where the bed is located within the room to make it easier to access for both the person and also for the carer or support person to access that space. It might also be about changing the bedroom. So, you know, we have experienced that where people have actually changed the room that they're in to make that process a bit easier as well.
If someone is sleeping with a partner, that changing the side of the bed, because the other side of the bed might be easier for them to get out of, there might be more space for them to then stand up and move into a bathroom, or there might be more space for equipment if that's required. Something that we can implement is things like a call bell, which someone might have next to the bed or on their person whilst they're sleeping, that they can press if they become uncomfortable or distressed throughout the night.
Someone with motor neurone disease that affects their movement and overall circulation might be struggling with keeping warm or staying warm. So things like wearing warmer clothing or extra blankets to help them manage that when they otherwise can't help themselves. Looking at other things like bedding, is it heavy blankets that are weighing someone down? When you add into that the muscle weakness side of things, that can make manoeuvring and repositioning really hard.
We talk about a lot in occupational therapy about planting a seed early around what intervention might be needed further down the track. So if we're able to engage with a client and their carer or loved ones early on and talk about those things, it can help both build that rapport with them, develop that therapeutic relationship, but also introduce ideas around interventions that might be beneficial further down the track.
Certainly we need to speak to the person with MND, we need to speak to their carer and other family members who can usually provide some really useful insights as to how they, the feedback they're getting from the person. They might remember more about what the person is reporting to be comfortable or uncomfortable more than we actually remember for ourselves. So certainly it's a team approach to identifying what works and what doesn't work. Because it's a difficult thing to describe, and if somebody is experiencing additional difficulties with communication, we can make use of photos. They can be really effective in showing how somebody is sleeping or showing a desired position for sleep. Videos we can use, email we can use to kind of back and forth with problem solving around that with the person or their carer. We can make information sheets with photographs so that if there is somebody needing assistance with bed positioning or as a reminder, or if they're needing assistance from family or an in-home support service, there's some consistency to how the positioning is happening. One thing I guess initially we look at is the bed height, and is that an issue? We also look at whether there are some small aids that can support a person to independently get in and out of bed. Then we look at teaching carers and support people ways of assisting safely. So we certainly, at the forefront for us is making sure that carers are staying healthy, well, and free of injuries associated with that role of being a carer. So we do spend a lot of time in our sessions at people's homes and in clinic teaching people about safe ways to physically assist.
In terms of equipment and things like that, obviously MND Victoria have an incredible equipment library that we can access as health professionals. Bed wedges and side-lying aids that we can implement, which I guess are more specialised to help someone lie in a certain position. A common thing that we can implement to help someone move in bed or get comfortable in bed is what we call a bed pole. And effectively it's like a pole that comes up next to the mattress, and someone can hold this to sort of help them reposition in bed. It can be used to help go from lying to sitting as a bit of an anchor point.
Leg lifters can be really useful aids if someone's experiencing increased weakness in the legs and feet. A leg lifter can be used, you hold onto it and you can place your feet inside the leg lifter. You may need some support to do that, and then it helps to lift the leg or foot into the bed more easily using a little bit of upper body strength. A bed cradle is a device that can be fitted at the end of the bed. It avoids having weight over the legs if you're experiencing increasing weakness, so you can move around in your bed more easily.
The bed is more comfortable, especially with the air mattress. I sleep like a baby at night now.
There are mechanical beds these days that look more like a standard bed. They don't look like a hospital bed. What
carers tell me is that they often need to try multiple different things. It's been interesting hearing that the piece of equipment that seems most obvious doesn't work, and then something that was a little bit left field might actually work.
We'll often plant the seed about those scenarios, and getting equipment in early, particularly when it comes to bed comfort, giving as many options as possible to help them manage.
The earlier notice we can get on those changes and the earlier introduction to services really helps with making that process smooth.
Don't feel like you're a burden in asking for help. It's what we're there for.
We might strike gold with a comfortable position for somebody, and that might be really game-changing, but that can then change.
It's trying to, I guess, take away some of those difficulties and eliminating that, so to allow someone better rest and helping them with getting a good night's sleep.